My dear colleagues, welcoming all of you to today's program. Today's program is on acute coronary syndrome. You know, acute coronary syndrome includes some entities: ST elevation MI, non-ST segment elevation MI, unstable angina. I am going briefly. If a patient comes with chest pain, you should do X-ray, chest view, ECG and biomarkers of cardiac enzyme like troponin I. X-ray chest view is to differentiate whether it is pulmonary cause or cardiac cause of chest pain. If you see that there is ST segment elevation and biomarkers is raised, it is ST elevated MI. It is an emergency case. You should go on thrombolysis by streptokinase. And if you see that there is no ST segment elevation, rather there is ST segment depression or T-wave inversion, and there is biomarkers are raised, then it is non-ST segment elevated MI. If there is biomarkers are normal, then it is unstable angina. Okay. Now you know how acute coronary syndrome develops. Actually, the problem is atherosclerosis. This process is an ongoing process through the lifetime of a person. Through the lifetime of a person, there is fatty deposition, which is surrounded by a fibrous cap of collagen tissue, macrophage and lymphocyte. Macrophage, when release metalloproteinases, then the fibrous cap disrupt and there is a stimulation of thrombosis. Then the thrombus is the culprit which prevent the forward flow of blood, and the cardiac cell is injured or dead. This is the mechanism. This mechanism is actually a difficult mechanism. I am describing it briefly. Actually, there is a macrophage infiltration, as macrophage then release cytokines, and there is inflammation, and the process is progressing. You know, there are some risk factors that like smoking, hypercholesterolemia. This causes continuously endothelial injury, and then endothelial injury stimulate this atherosclerosis. Okay. Now, what is your target to treat the patient? Your target is to relieve the symptoms and to treat the complications and prevention of future occurrence. That is secondary prevention. In all these cases, we use actually lipid lowering agent, antiplatelet, anticoagulant, thrombolysis, nitrates, and some interventions like PCI and CABG. Primary prevention. If you do not subscribe my channel yet, please subscribe my channel and press the bell icon to get a new video from me later. Thank you very much.